Now we're going to be changing an incontinent brief. I'm going to have a basin with warm water in it and some soap. I'm going to have a couple towels and some washcloths. I'm going to have my gloves, some toilet tissue to clean up any extra stool, and I'm going to have a couple plastic bags, one for the linens and one for the incontinent brief to go into. So I'm going to put on my gloves. I've already done my beginning 5. I'm positioning my patient. Oh, before I put on my gloves, I'm going to position my patient. Mr. Smart, I'm going to raise your bed up. I raise the bed to a comfortable working height. Remove the call light. I'm going to apply my gloves. I'm going to put my plastic sacks on the end of the bed, one for the incontinent brief and one for the washcloths. Going to before I expose my patient, I'm going to cover him with a towel. And then I'm going to remove the incontinent brief, rolling it into itself. And I'm going to do front pericare at this time. After I've done my front pericare, I'm going to assist my patient to turn onto his side, keeping him covered. And if there was any stool here at this time, I could use my toilet tissue to remove the extra or the excess stool. I'm going to put my incontinent brief in my trash sack, and then I'm going to perform back pericare. And after I've performed back pericare, I'm going to remove my gloves, wash my hands. So now I'm going to take my new clean incontinent brief, and I'm going to position this right up against my patient. And I can even gently put this between his legs here. I'm going to dispose of that. And I'm going to assist my patient to turn over onto his back. Going to make sure the tabs are fastened on this one. Recover my patient. Lower the bed. I'm going to dispose of my used linens. And the used incontinent brief, per facility policy, and I will clean up my supplies and do my ending 5.